It's critical we work together as a healthcare system because we want people to experience good joined up care where they see the right person in the right place at the right time. That requires the whole system to work together as though it were one, even although we work across many organisational boundaries.
It's really important for adult social care that system partners work well together. So within adult social care, we want to have empowered, confident staff that have conversations robustly with people like general practitioners and acute clinicians, because it really makes a difference for the individual that we're supporting, whether they be at home or in the acute hospital. They can tell their story once, and professionals trust each other in decision making. It has a massive impact, both from staff and the experience that individuals receive.
It's absolutely essential that the hospital works alongside its partners in the healthcare system in order to deliver the very best care for patients. A hospital is simply one part of a system. Other partners such as primary care, the ambulance service, adult social care, community services and others are absolutely essential to the best care pathways being delivered for patients. And we've been working really hard in North West Surrey to do that better, and I can certainly say that my experience is that we're working much better together.
So in North West Surrey, I think we've made real progress over the last 2 years about the urgent care pathway. But this isn't just about getting patients out of hospital. We're working much better together to design the system to be fit for the future. We know that we need to change significant elements of how the system works to be sustainable in the long term. And it's great to see all the partners coming together to work out today what's the right model of care that we all want to work towards. We're already doing lots of work with the Acute Trust, for example, to talk about how the hospital is sustainable for the long term. We're also working with community services to work out how we wrap community services around practices to make sure that those people working outside of the hospital are just as consistent, coherent and joined up as a hospital system is able to be.
Last winter really gave us opportunities to work together differently. We took some brave decisions and supported each other as system leaders across health and social care to really make a difference to how we provide and support people across North West Surrey. And what we're passionate about is how that will influence our thinking for the future around what we do differently and how.
So we're working strongly together across the whole system to make sure we design care fit for the future that meets the needs of our population. And the needs of our population are growing. The demand on our services is increasing. We face a big challenge both in terms of money, but in terms of our ageing population, in terms of the many more things we can do for people with medical improvements. So us working together is really a prerequisite to being able to provide the best possible care for the people of North West Surrey. And I'm delighted that I know that all of the leaders around the system are with me. We are together in being determined to make sure we use our resources in the very best way to deliver the best care for the people we serve.
As many will know, we had a very difficult year last year. The winter was tough. And indeed, during that tough time, the system came together and we worked together to respond to it. But we've also taken a really great opportunity to reflect on what happened last year together and learn together so that we can do things differently as we go into this winter. One example I can give is that we now have a multi-agency team working in the hospital, reviewing pathways of care and working together as a team to ensure those patients are prepared and discharged to the right location safely. So that's a good practical example of what we've been doing together. There are other elements around control and command, escalation policies, how we communicate when things are very difficult and share information. And all of those things, alongside the additional commissioning that our colleagues in the commissioners have done to help us with out-of-hospital bedded and non-bedded capacity for patients, has been very, very important in the planning that we're doing for winter. So we will continue to work together as a team, and as I go into winter I feel more confident that we'll be able to respond to the challenges in a good and positive way.